Legible? Is it legible to everyone?
Yes, sir.
Okay.
Yes, sir.
So in the last class, I was telling you that why we call this tamoxifen and raloxifene as estrogen receptor modulator, because they not always act as agonist or antagonist to this receptor. Okay, sometimes let's say example in breast tissue, and it may antagonize, but whereas in case of uterus, it may antagonize. Okay? So antagonize. So that is why we call them as estrogen receptor modulator than calling as agonist or antagonist. So right now, what we are discussing, genetic factor as etiology. Okay. So I told you once they screen, they can opt for many options like oophorectomy, like chemoprophylaxis, like mastectomy, all those things. So who on the women who do not opt for surgical prophylaxis, okay, but those who tell, okay, I'm not willing to go for mastectomy or oophorectomy, intensive surveillance with annual mammogram and breast MRI screening, along with clinical breast examination every 6 months is the option. Okay. So just to detect it and catch it at the early stage. Whereas when you go for the when patient go for the test and they are negative for this BCRA gene mutation, that does not necessarily mean that, or that does not rule out that there is no hereditary form of breast cancer. So that is what I told you in the beginning. There are many controversial things, many contradictory things, and inconclusive thing. I will tell. This is not the confirmed thing that okay, BRCA mutation is giving you the one particular thing. Then there can be difference in interpretation. There are some other genes that has been identified and associated with breast cancer. They are TP53, CHK2, PTEN, and ATM. But most frequently gene that we see, even we use the implication of this BCRA mutation even in therapy, even in treating, even in therapy. Okay, so this is the one important factor, genetic factor that you need to consider. Okay, coming to the next and the last factor is environmental and lifestyle factor. Okay, so we'll discuss one by one what are environmental factors and what are lifestyle factors. What are the different factors under this comes. So diet. Okay, when it comes to diet, it has been shown that even in mice animal experiment, they found that the fatty diet, okay, fatty diet make more prone to get breast cancer. Probably this might be because this estrogen, progesterone, all these hormones are steroid hormone, right? They steroid hormone means um, they utilize these lipids. Okay, so lipids. So, this is hypothesis. Maybe this fatty diet intake might be increasing the synthesis of this hormone, or somehow modulating the pathway and making the people more vulnerable to get the breast cancer. So a low fat diet is linked to low blood estrogen. This is what I was telling. If the patient were given low fat diet, they found that there is low blood estrogen level and low blood cancer, low breast cancer risk. If you see some studies like where they saw breast cancer risk in relation to fruit and vegetable intake, they suggested that these have protective effect. These fruits and vegetable intake protect the patient from getting breast cancer. Okay, but again, these are not the results of many studies are contradicting even this, and these are not very conclusive. And this still stay controversial. Another dietary factor that they found was phytoestrogen containing diet. Phytoestrogen are nothing but these are plant estrogen, natural plant estrogen. These are found in soybean products like soybean products, then seeds, berries, nuts, So in this plant product, this phytoestrogen is found, and they found that the consumption of these phytoestrogen containing plant product slowed the rate of breast cancer in some of the Asian countries. Okay, so and in the Asian countries this soy consumption is high. So because of this compound, and why this might have happened, why this phytoestrogen, this is something you should give a thought. I told you estrogen make patient to get more risk of getting cancer, but here I'm telling you phytoestrogen containing plant product showed the lower rates of breast cancer. This is something like contradictory and opposite thing that I'm telling you now. Uh, so what could be the explanation of this that I'm going to tell you now? Why this might be happening? So this is hypothesized that this compound means this phytoestrogen containing plant product. This compound exhibit weak estrogenic property. Okay, some experts believe that they may function as relative anti-estrogen. Okay, so they can function as relative anti-estrogen. Relative anti-estrogen means, what is the meaning of relative anti-estrogen is that by displacing the natural estradiol. Okay, so this can come in. So this can does the function by replacing the natural estradiol. So this is how it might be decreasing the risk of getting a breast cancer, and that is what it is hypothesized. But again, these are not very conclusive things. So the conclusion is that about the diet, low fat diet may reduce the risk of occurrence, and improve relapse-free survival. Okay, relapse means after one episode to another episode of breast cancer. So that time period can be increased. Okay, relapse-free time period can be increased by taking a low fat diet, and even in the patient of resected breast cancer. Coming to another factor, another environmental factor, and lifestyle factor. So we have something, we have weight, height. Okay, that is, the combination of weight, height gives a parameter of body mass index. Okay, BMI. So if the patient is obese, if he or she have high body mass, and that means we say that there is hypothesis that there is increased chance. Okay, but again there is a complex relationship involved. Again, menopausal status, menstrual cycle, all those things has to be considered. But still they have hypothesized that these the height and weight, BMI, have some risk or some contribution in making a patient more vulnerable to get a breast cancer. And you cannot modify a height. Okay, but of course many of patient can modify weight. Okay, so by modifying weight, the patient can adjust their BMI and can stratify this risk. Some study, these were some of the risk factor related to environmental and lifestyle. Another risk factor related to lifestyle is physical activity or exercise. Some study have reported that there is inverse relationship between physical activity and breast cancer. That means if the patient did exercise, the chance of getting breast cancer was low. Okay, so again, there can be many explanations why this might have happened. Those who did exercise had less chance of breast cancer. Exercise have many impact on our body, many hormonal impact as well. It can affect the hormone in many way, and how from right from release to the receptor level, how it acts. And you also know the exercise can again affect body weight, and that is BMI. And the exercise can also affect the insulin, the sensitivity of tissue or sensitivity of insulin receptor. So all many factors can be there, that why exercise had this kind of impact on breast cancer. Okay, so exercise in women following a diagnosis of breast cancer may also increase the likelihood of overall survival. Okay, so the women who already have been diagnosed with the breast cancer, if she is doing this exercise, that means all these hypotheses that we talk might be in play, and that can even increase the likelihood of overall survival. Okay, clear till now? Okay, Rajan, what factor we are discussing?
Sir, genetic factor.
And no, come on, genetic factor. Is it genetic factor? Divya,
No, sir.
what?
Sir,
Environmental
lifestyle
factor
in
about
the man.
exercise.
Divya, what factor?
About exercise, how it affects the
What wonder what
breast
factor
cancer.
under what class of factor these things are we are discussing?
Environmental factors.
Yeah, environmental and lifestyle factor. Okay, so so under environmental and lifestyle factor we discussed about what and all. Can you summarize, Ravi, what and all we discussed about environmental and lifestyle factor? We discussed about diet, okay, where we talked about
The
diet.
diets and the physical activities
Mm-hmm.
and the way
Body
the
weight,
lifestyle is
BMI,
like
yeah.
BMI and the
Okay, so this and all, okay, and exercise and all. So now coming to the next factor under this environmental and lifestyle, the alcohol intake, okay. And alcohol, like alcohol intake, of course, you know, this comes under dietary and lifestyle factor. So right now whatever we discussed already under this environmental and lifestyle factor, we you saw that we are not very clear in many of these things. I'm telling hypotheses, I'm telling inconclusive, controversial, contradictory things. But this is not the same case with alcohol. It is very clear in case of alcohol, that with the with case of in the case of trial involving alcohol, the relationship is very clear. Okay, the relationship is very clear. So what might be the relationship? Can you tell? Can you guess? Positive association. That means if the patient, if the cohort was taking alcohol on a regular basis, they found that increased risk of breast cancer. So even they found dose dependent relationship. Okay, so that means at increased dose, increased risk. Okay, the risk increases with the consumption of alcohol in general, regardless of the beverage type. Okay, whatever, regardless of the beverage type or regardless of women's menopausal status. That's why I told you this, the relationship is very clear with the alcohol. Yes, if the woman is taking alcohol, though, we it's not like, okay, whether if the patient is menopausal or whatever, the other factor doesn't come much into play, and we be confident that, okay, this consumption of alcohol have chances of getting this getting breast cancer. Another environmental factor is radiation. When I talk about radiation, there are many forms of radiation. Let's say, generally this radiation exposure increases to getting breast cancer, risk of getting breast cancer, if the patient woman is less than 20 years, that's young age. And um, many patient, you know, many cancer patients themselves have to go under radiation, because one of the modality of the cancer one of the modality of cancer treatment is radiation therapy. That's what we have read, isn't it? So let's say the patient who have other form of cancer like Hodgkin lymphoma and they go under a repeated chest radiation and all those things, that itself can increase the risk of getting breast cancer. Okay, from simple chest X-ray that is done in the routine, even that have chances of increasing the uh, female patient to get a breast cancer. Okay, depending on how frequently and how strong radiation is. Okay, so these were the general risk factor, that the risk factor or etiological factors that we discussed for the breast cancer. Any doubt in the risk factor or the etiology of the breast cancer? Anybody have? If no, then I will move on to the clinical presentation. Anybody have?
No,
no sir.
sir.
Okay, so moving on.
No.
Moving on to clinical presentation, that is the sign and symptoms. So in general, the sign and symptoms, what symptoms will be happening is the patient will may have symptoms, or some of the patient may not have symptoms also. Okay, and this is generally detected in the routine mammography. routine mammography is they go on a routine basis to have a scan of breast, and then if they find any lump or any mass in the breast, then they then get detected. So in general, they may have some symptoms, they may not have some symptoms. Okay. Coming to local sign and symptoms, they may have painless or palpable lump. That's the most common symptoms. Okay, painless or palpable lump. And less common symptoms is like pain, nipple discharge, retraction or dimpling of skin edema, and redness or wound. Okay, these are the less common signs, but most common sign is palpable lump. Okay. I'm talking about local sign and symptoms. Okay, local sign and symptoms again, in local regional lymph nodes may be present or absent as well, but sometimes it is present. That's what I was telling. We'll discuss about the lymph node. Okay, it's very much important when you talk about breast cancer. The role of lymph nodes, even while staging, is coming up in the next section. So these were the local sign and symptoms. Then systemic sign and symptoms of systemic metastasis. We'll discuss. We'll see what are the sign and symptoms of systemic metastasis. This again depends on sites. What are the places where metastasis has happened? But it may include like bone pain. When I talk about bone pain in context of breast cancer, I'm talking about a rib bone. Okay, I'm not talking about the entire all the bone of the body. So they may have bone pain. They may have difficulty in breathing. Okay, if it is metastasized, they may have abdominal pain or abdominal enlargement, even jaundice. Okay, and mental status change as well because of liver function. These are the signs and symptoms of systemic metastasis. Coming to laboratory test, okay, we'll discuss this in detail in the diagnosis section as well. It is coming. It is the next section after this. Diagnosis, we have some tumor marker. Okay, for example, CA27.29. We have some antigen like CEA, carcinoembryonic antigen. So these are a simple blood test. In that, if they detect it, that means the patient is having cancer. And cancer or prone to again this has to be treated with other tests also to come to the conclusion. If they, as I told, this affect liver also, there can be abnormal liver function test like elevation of alkaline phosphatase in metastasis case. That's what we discussed here, the symptoms of metastasis. Other diagnostic tests can include mammogram. Okay, that can be again with or without ultrasound, breast MRI, or both, mammogram with breast MRI. And then sometimes they may go for biopsy for doing a pathological review and looking at the tissue in detail, okay, and the extent, to what extent it has gone. And on histopathology, they can also figure out HER2 status, okay, the receptor status, whether the tumor have tumor is receptor positive or not, whether they have estrogen receptor positive, progesterone receptor positive, or HER2 receptor positive. This is important. Okay, based on this, we can modify our treatment. Actually, that's why this is important. Now, systemic staging test may be done, and they may include like chest X-ray, chest CT of the chest, bone scan, abdominal CT, or ultrasound or MRI. Okay, so these are some of the general signs and symptoms, clinical presentation of breast cancer. We'll be diving towards the diagnosis now. We'll dive towards diagnosis now. Actually, as I told, the physical examination, the clinical examination, careful history, and anybody in the family have that or not. The mammography, 3D mammography, and the other imaging technique like MRI, ultrasound, CT. So all those things are the initial workup. Workup of any woman who present with any lesion or any symptoms that suggest of breast cancer. Most breast cancer will be visualized in this mammogram as a mass or cluster of calcification or both. Okay, so this most of the cancer, breast cancer, will be detected by this. And we discussed in the beginning what are the factors like what are the factors like what kind of breast tissue may be able to may be hard to detect through this mammogram, and what are the factors that can affect this. Okay. Factors that affect the ability of mammogram to detect cancer include like breast density. This is what we were talking. And this can again be affected by age, menopausal status, and hormone replacement therapy as well. Breast biopsy, this is what we're talking in diagnosis. This is again indicated